How's it going, guys? Dr. Valera here. I wanted to explain how an EpiPen works. So an EpiPen is used for anaphylaxis. So anaphylaxis is a life-threatening allergic reaction. So there's kind of a confusion as to why an EpiPen with epinephrine would help somebody that is having their throat closed and are going into shock because their blood pressure is dropping. So you need to understand the autonomic nervous system in order to understand how an EpiPen is actually going to save a person going through anaphylaxis. All right, so the autonomic nervous system is called autonomic because it's non-voluntary. It happens on its own. So there's two elements to that. You have the parasympathetic nervous system, also known as the rest and digest, and you have the sympathetic nervous system, also known as fight or flight. Now that is a little bit of an oversimplification. A lot of people think that the sympathetic nervous system increases a lot of stuff and the parasympathetic nervous system decreases. But that's not true. As you can see, there's quite a mix. So some of the things that you're gonna see are gonna be affected is heart rate, breath rate, vasoconstriction, the diameter of the blood vessels, which is gonna control the blood pressure, bronchial constriction, the airways, how wide they are, peristalsis, which is the speed of digestion, that's the muscular action of digestion, neural firing rates, how fast are you sending signals between your neurons, renal filtration, how fast are you producing urine, and then pupil constriction, the dilation or constriction of your pupils. So as you're going to see, the parasympathetic nervous system is going to decrease the heart rate, it's going to decrease the breath rate, it's going to dilate the airways, and it's also going to decrease the neural firing. That's when you're resting, your brain isn't working as fast. But it's also going to increase a lot of things, right? It's going to increase that tension that you have on the airways because it's not as necessary for them to be open. It's going to increase your digestion, obviously rest and digest. It's also going to increase how fast you produce urine and the amount of constriction you have on your pupils. Now, the sympathetic nervous system is literally going to do the opposite of all of that. Now, where does the EpiPen fall in here? The EpiPen is going to activate the sympathetic nervous system. Now, why do you want to put somebody in a fight or flight state when they are in an allergic reaction? That's because there are two life-threatening symptoms, which is going to be too much bronchial constriction. The airways are closed up and there is not enough vasoconstriction and the blood pressure is suddenly dropping. Those two are life-threatening symptoms. So you need to get this sympathetic nervous system on, which is going to dilate the bronchioles, and it's also going to constrict the blood vessels so that your blood pressure brings back to normal and that your airways open up so that you don't suffocate. Now that also comes along with everything else because you can't just get part of the sympathetic nervous system on, which you're gonna see that's gonna cause the person to have a bunch of unwanted symptoms like really fast tachycardia, they're gonna have a high breath rate, right? They're going to, pupils are gonna be really dilated, they're going to be thinking really fast, they're probably gonna get a headache, and they're going to shut down their digestive system for a while because they had just gotten shot with adrenaline, which is also known as epinephrine. So if you are self-administering epinephrine, you need to make sure that you know the different parts of the EpiPen, right? So we have the safety, which is on top, blue for the sky, and then there's going to be whatever other color it's going to be. It's going to be different depending on the EpiPen, right? So blue is always up, so you want to make sure that you take the safety off first, you grasp it firmly, and you're going to put it into the thigh, and you're going to hold for about 8 to 10 seconds to allow for the epinephrine to come out. And then you're going to pull back out, and you're going to see that there's a safety mechanism that is going to prevent this from triggering twice. So that means that if you miss, you don't get a second chance and you lose the EpiPen and you have to get a different one, right? But that also means that you don't accidentally stick yourself with that needle.